All right, well, welcome to today's webinar, Medicaid 101 for Dental Providers. My name is Jessica Emmerich. I am the Dental Medicaid Facilitator for the Missouri Coalition for Oral Health. I work with MoHealthNet and the Missouri Dental Association to assist providers with enrollment, credentialing, and billing questions. This webinar will give you an overview of the Missouri Medicaid system for dental providers and give you some insight as to what to expect as a MoHealthNet provider. The Missouri Coalition for Oral Health is a 501(c) advocacy organization focused on policy and system change to increase access to oral care for all Missourians. Over the years, the coalition has achieved multiple successes, including the reinstatement of adult dental benefits in Missouri Medicaid in 2016, and most recently, the rate increase of the Medicaid dental benefits effective July 22. This substantial increase helped to bring reimbursement rates to those near commercial levels in Missouri. To learn more about the coalition, you can visit our website, Facebook page, Twitter, or LinkedIn. At the end of today's webinar, you're going to be emailed a survey to complete to receive your continuing education credits. Today's webinar is being recorded and the recording will be made available on our website. Because this is in a webinar format, all attendees are in listen-only mode and questions can be submitted in the chat and Q&A box. Both of those are at the bottom of your Zoom window. All questions will be answered at the end of the presentation. Let's see, now I would like to introduce you to our speaker for today, Amanda Farendorf. Amanda is the lead education and training specialist with the MoHealthNet division. She provides education and training to MoHealthNet providers, participants, and staff. Amanda has been with DSS for 21 years, worked for Child Support Enforcement, Children's Division, and MoHealthNet during that time. As the lead education and training specialist, Amanda provides training and interpretation of MoHealthNet policy, program limitations and benefits, and proper billing procedures. Amanda trains providers through webinars, workshops, and one-on-one discussions. You can find more of Amanda's training and resources on the dss.mo.gov website. So Amanda, if you are ready, I'll go ahead and turn it over to you.
Sounds good. Thank you. Again, my name is Amanda Farendorf. I'm the education and training rep over the dental program. Today, I want to give you guys a big picture of Medicaid, and then we're going to drill it down into what to expect with dental specifically. Now, I'm going to go ahead and start. This is MoHealthNet 101. So the objective today is I really want to take a big look at MoHealthNet specifically, talk about eligibility, the types of coverage, and the benefits that are offered through MoHealthNet. So what is MoHealthNet? MoHealthNet is a Missouri Medicaid program. So individuals who do not have health insurance or need help paying for health care may be eligible for coverage through MoHealthNet. So here are the different eligibility categories, and this will depend on the individual's age, their income, their health, and individual needs. So individuals may fit into one of these categories. So it would be seniors age 65 and older, parent or caretaker with a child under the age of 19, child age birth to 18, women with no health insurance age 18 to 55, and then adults without disabilities. I wanted to bring that to your attention that adult without disability is that Medicaid expansion program, the adult Medicaid expansion. So there were several people or lots of people that were made eligible through the AEG, adult expansion program. Now, which allows several people to access it. Pregnant women 19 to 64, women with breast or cervical cancer under age 65, persons with disabilities and no age limits for that, blind or visually impaired age 18 and older. So those are just the categories when someone would go and to apply for MoHealthNet. This is how they would access that. So this is just a general guideline of how somebody would go about applying for MoHealthNet. There's 3 different ways they can do that. This is just a little reference for you. Okay, so once somebody's eligible, they'll be provided, with information on, eligibility. Okay, so this is what's really important, the types of MoHealthNet coverage. So once a person's approved, they will either be fee-for-service or managed care. So what's the difference? Fee-for-service, you're going to be working with MoHealthNet directly. So you'll follow our policy, our rules, we'll work with you on billing. And then there's managed care. Managed care, we have 4 different managed care companies. We'll have, well, and I'll hit that here in a second. We'll go to that slide. So who qualifies for either one of those? So fee for service would be people with disabilities, seniors, the Medicare population, blind or visually impaired, women with breast or cervical cancer. So that's fee for service. Then we have managed care, which would include children, pregnant women, newborns, and families. All right, here are 4 managed care plans. So we have Healthy Blue, Show Me Healthy Kids, Home State Health, and United Healthcare. And if you've been working with MoHealthNet already, Show Me Healthy Kids is a new program that started July 1st of 2022. And what this is it took like state custody kids, adoption subsidy, youth in care of the state. Those individuals were all moved to Show Me Healthy Kids because there's going to be some additional benefits around that plan, specifically to behavioral health, so that we want to make sure to give those individuals additional benefits to help them. All right, so the benefits will differ based on how a participant qualifies for MoHealthNet. So all participants are assigned an ME code, which is a medical eligibility code that really, it kind of routes them into what benefits they would receive. So on here, I have a hyperlink to the provider resource guide, which I'm going to hit here in just a second as we go through this. So the provider resource guide shows you what each ME code means. And each ME code tells you what kind of benefits they have. Now, this is big picture, which means it encompasses all programs. So like the full comprehensive package, it would cover these individuals. You know, there's other ones as well. So old age, blind pension, adult expansion group, right down here with an E2. If you've been working with Medicaid with already, you would kind of know some of these, but this is a good resource for you to go and look at. All right, so let's talk about managed care a little bit. So managed care has several different benefits. They're going to offer the same benefits MoHealthNet offers, but they can offer additional ones, as well as you can negotiate your rates with them. But right now, I mean, the rates have bumped up considerably, and the managed care plans have already implemented those rates, and they're working on reprocessing all those claims that were submitted. And we'll talk a little bit more about the rate increase soon. So this is just a list of all the different benefits the managed care plans offer. Now, I wanted to kind of bring up some things that a lot of providers don't know. And, you know, a lot of participants don't know this. So each managed care plan offers additional benefits that are kind of outside of MoHealthNet. MoHealthNet is not paying for these benefits. These are private companies that are administering the MoHealthNet program. So they offer a lot of things that we don't. So like pregnant women, new moms, like breastfeeding kids, home delivery meals after delivery, Weight Watchers, like after school programs for kids. I just wanted to put some of this stuff in here for you just to have it. I mean, or just to at least have a reference for it, just in case somebody, you know, you can mention it to someone. And this one's for home state. So they have after school programs, baby showers for moms, Weight Watchers. It's the same, similar things for all the plans. All right, so fee for service. Fee for service, this just lists our benefits, which are basically the same as the managed care plans. But I wanted to make sure to put it out here so you can look at them. Okay, just some highlights of what MoHealthNet covers, and we're going to get into dental here in just a second. I just wanted to bring up some of this information. A lot of providers don't know, you know, what kind of things people qualify for when they have MoHealthNet. Of course, they qualify for dental. Everyone, with exception of one ME code or two, 80 and 89, which is family planning, all MoHealthNet participants qualify for some type of dental benefit. And we're going to talk about the differences between those. And of course, durable medical equipment, hearing aids, audiology. This is important. A lot of providers don't know this, and it's helpful when you're talking to individuals that are on MoHealthNet. We do offer hearing aids to children, pregnant, blind, and people residing in nursing homes. So I feel like that is kind of helpful. Behavioral health, everyone can access behavioral health. Optical, everyone, with exception of those 2 codes I mentioned, qualifies for optical. And here's one that I really want to hit on: non-emergency medical transportation. So in the dental offices, you're getting your appointment set up and a participant says, I don't have a way to get there. So MoHealthNet offers non-emergency transportation where a participant would contact our broker, which is MTM, and say, hey, there's a whole process of them getting a ride to the doctor's office, a ride to and from. Has to be a scheduled appointment and a Medicaid covered service, but it is something that's available. That's available through fee-for-service and managed care. And but all the plans and MoHealthNet uses MTM. All right, so let's start talking about dental a little bit here. Well, actually a lot. That's what we're going to spend our time on. So there's two different benefit packages. These lists are not all inclusive. I just took some of the headers out of the provider manual and put them in here so that you can have a big picture of what type of benefits are covered. So there's a comprehensive benefit and there's a limited adult dental benefit, which was implemented in 2016, like Jesse had mentioned earlier, which is great because there's so many more people were able to access care. So what is the difference between comprehensive versus limited, and who qualifies for each one? So comprehensive would be for children under the age of 21, individuals that are pregnant, blind, or residing in a nursing home. So there is a whole list in our provider manual of all the different services that those participants are eligible for. Now, the participants over the age of 21 who are not pregnant, blind, or residing in a nursing home, they're the ones that are going to get the adult limited dental benefit. So this is something that's really important that we keep mentioning is the rate increase. So as of July 1st, MoHealthNet has approved the dental rate increase, and there was several codes, lots of different dental codes that were increased. Not every code was increased, but there were a lot. So this bulletin right here will break that down for you, and you can see all the codes that were increased and the rate. So this is just a snippet. Down here it says that this is not all inclusive. There's several other codes that were increased as well. But just to give you a big picture. So this DO 120, I think it was like $24. So that rate doubled basically. The limited oral evaluation. I mean, there's a lot of these different codes that went up considerably. And then I put a link down here to that dental bulletin so you guys can go there and look at it. All right, so let's talk a little bit about Medicaid in Missouri and how you can fit into this picture. So approximately 12.7% of all Missourians, which is 785,000 people, live in families with incomes below the federal poverty level. So an example of this is a family of 4, 2 adults, 2 children would earn less than $27,479 a year. So in that family, we can see that there's really no extra money for healthcare. I mean, they can barely afford what they need on $27,000, right? So approximately 1 out of 8 Missourians are receiving benefits through MoHealthNet, to include medical and dental. Now, this information was provided by the Department of Health and Senior Services Office of Dental Health. Reasons to accept Medicaid. So it helps the most vulnerable in your community. With the fee increase, you're still able to provide care without financial loss. Previously, a lot of providers, that was an issue with them, which of course I can understand, because treating MoHealthNet patients, it was a loss. They took a loss. They had to write off a lot of things to be able to serve this population. You're able to give back to your community, and you're able to provide preventative care to children and give them a dental home. So here are some more reasons to accept Medicaid. You don't have to provide care to everyone. So that's a common misconception. A lot of providers are like, well, if I say I accept Medicaid, then I just have to accept everyone. That's not true. You can limit, like say you want to take 20% Medicaid, or say you just want to take children, or you just want to treat, 15 people that you knew in the community. I mean, you don't have to accept everyone. So that's a positive thing. You can help your local hospitals by keeping non-traumatic dental pain patients out of the emergency room, which is great because if they had access to more providers, they would be able to go and see you guys instead of going somewhere that's really just going to put a Band-Aid on the problem. You guys would really actually be able to fix it, right? You can set an example for your dental community that you're willing to care for the underserved. And then many patients have to travel long distances and have long waits for care, and you can help alleviate this. That is true. I've worked with the dental program for 8 years. I've trained on this program and worked with lots of providers and participants, and that is an issue. We really need more providers in all of our different, all the communities and all the counties, especially in the rural areas, because they are traveling long distances to, say have an extraction or a root canal, or any number of things. So it's really important that we try to get more providers. Okay, so who are Medicaid participants? Sometimes it's good to just step back and say, okay, who is on Medicaid? There's a lot of common misconceptions. So let's say a single mom. And a lot of providers have, they say, well, my dental assistant, they're on Medicaid, their children are on Medicaid, foster kids, low-income adults, the working poor, blind, disabled, pregnant individuals, children. From all walks of life, these individuals have to access MoHealthNet Medicaid benefits. So here's just an example of looking at the rates, the rate differences. So like your office fees in this column, other insurance. So this is just, we pulled this, well, actually, the Office of Dental Health pulled these numbers together. But so you have your rates, then you have the other insurance rates, and then you can look at how MoHealthNet hits up against that. Now I see that you're off for a periodic exam at 71, other insurance could pay 66, but then there's 48. Prior to this change, it was a lot less, like $24, okay? Which this rate pretty much doubled. But as you go down, you can see that our rates are comparable. This $85, $78, $71.20 before you were taking a loss. And in some places, you can see that our rates are higher, like this DO 230. Look at that, $16 with private insurance, and then $23.20 for MoHealthNet. As you go down, you can see more of those things. Now, these are just the top dental code fees. There's lots more, and you can compare them against the other insurances. All right. So I just wanted to give you guys a big overview of MoHealthNet and just hit on some of the highlights. Now I want to get into our provider resources, things that MoHealthNet providers need to know. So a lot of providers they'll say, okay, well, I'm only going to accept kids, and kids are going to be in the managed care plans. Why do I need to know what MoHealthNet benefits are, or the resources for MoHealthNet? Everything that's offered by the managed care plans the foundation is fee-for-service MoHealthNet. So you should understand what's actually covered so that you can make sure that the patients are getting the same benefits through the managed care plans, as well as there's going to be different resources that would be helpful, just like that ME code chart where it tells you what all those ME codes are. That information is really important, and that would be on our fee-for-service provider page. I'm going to hit on several different resources. One would be the provider manuals. Another is education resources. I have lots of PowerPoints, things out there for you guys that will drill down all the way into billing for your billers. Provider hot tips and provider bulletins. Now, these are all hyperlinks that'll take you there. So when you have the PowerPoint later, I'm going to go ahead and click on MoHealthNet provider page. So this is kind of a hub for all of our resources offered by MoHealthNet. Down here, there's MoHealthNet News. We always tell our providers to sign up for MoHealthNet News. This is a distribution list that we use to notify providers of any changes, any new policies, training, a rate change. This is how we told providers the rates changed, and keep them updated on what's going on. So we'll send out bulletins, hot tips, email blasts. So I always encourage my providers to enroll with MoHealthNet News. And the next thing I'd like to cover is policies and procedures, provider bulletins. So a provider bulletin would be introduction of a new policy, changes to policy, clarification of policy, rate changes, really important things that we want to bring to your attention. Are we going to start covering a new code? That type of thing. So we normally keep about a year's worth of information on here, and then we archive it. So it's just click on this. You can search by the bulletin. Now we do have a new function that we think is really awesome. If you click on this, this is the bulletin index. And you can just go through on this and just search for dental And it'll be every bulletin that was ever issued for the dental program. I think it goes back to like 2000. Oh, look at this. This is 2003. That's a long time ago. So this would be something that would be helpful if you ever want to go out and read some bulletins. Before, you would have to just search, Control F and search for keywords, and there's a lot of them. So here's an example, dental program. So this is just introducing that we are going to pay for D4346, and then it discusses the reimbursement and tells you we started paying for it on July 1st forward, and then who would qualify. Now, I won't get into this specifically. I just want to show you the kinds of information that we provide on a bulletin. Now, Jesse, I see that there's questions in the Q&A. If you want me to stop for a minute and answer those, I can, or we can just keep on moving through the presentation. And of course, I will definitely answer everything at the end.
If we want to go ahead and try to answer a couple now, we can, if this is a good starting point.
Yeah, it looks like there's only 3, so I'm sure I'll be okay. So Katie says, I didn't hear you mention the category for those in foster care and transitioning out of foster care. At what age do those benefits end? So there's 2 different ones. I believe there's a ME 37 and ME 38. So I think at 37, they transition out. A 37, they transition at 18, and a 38 is at 26. So based on that ME code, the individual will receive benefits longer. All right. So now most of those people are in Show Me Healthy Kids because that's where they've been moved to, but they should be covering the higher level of benefits all the way to age 26 for an ME 38 for sure. Lauren asked, can we get these slides emailed to us after the webinar? I'm sure that Jesse's going to do that, right, Jesse?
Yes, that's correct.
Awesome. Oh, Karen Dent. She's one of my favorite. There's a massive shortage of dental assistants. Amanda mentioned that many dental assistants qualify for Medicaid benefits. Why would they work in such a challenging and demanding field for wages that cannot sustain their families without government assistance? Well, I'm thinking that was probably a question for everybody. I mean, that is something to really think about. I mean, a lot of these people that you are going to be serving are your neighbors, your coworkers. Dr. Deaton, any changes on the SDF? Silver diamide fluoride, I think that's what that means. I know that they are considering that right now, based on a discussion that I heard. Now, the policy hasn't went through yet. I know it's under consideration and they've looked at the fiscal impact. So I know that there's something actually going on with that, but I will email you specifically, Dr. Deaton, and let you know anything that if I'm hearing anything. I did send you an email the other day about it after I heard something. Okay, I think that's it. Okay, no questions. Okay. All right, so we'll keep on moving through everything. I'm going to go ahead and go back to the provider page. All right, the next thing I'd like to hit on is hot tips. Hot tips, these aren't necessarily like a bulletin. They're basically hot tips. They're smaller little, pieces of information that could be helpful. Do we have trainings, resources, just a little tidbits of information. We normally keep these out here for a year. We just need to update this and say 2023 now. But anywho, if you just go down through here, you can just see different things that may be helpful. Oh yeah, hey, this is really important. If you're already an established provider with MoHealth, you know that during the public health emergency, we kind of froze all ME codes. So some individuals, if back in 2020, they were pregnant, right? MoHealthNet was not allowed to change their ME code to have a lower level of coverage. So that individual for the past 3 years has been eligible for pregnancy Medicaid. So starting April 1st, we're going to start notifying, well, not MoHealthNet, but the Family Support Division is going to start notifying participants that they need to go ahead and start providing their information and do a renewal. And this is just basically letting everyone know that that's getting ready to happen again. So it'll be April. They have like a 3 months, like 90 days. So it'll be like in June when they actually have to have everything in. So there is an option on EmoMed that shows you when their next renewal date is. If you want to look at it, you can. So like, this is just an example of something that's going on. That is really important. This is a provider communications update. And this is why it's really important to just take a look at some of these and being signed up for MoHealthNet News. Like anyone that's called in on our provider communications line, you have to listen through all the prompts and all the things. Well, before you had to just keep entering like information 3 times and then get to a person. Now there's option 6 on there. So you can just hit 6 and get to a person without going through all that extra. Of course, we still want you to use the phone line and try to get automated, information. But if you actually need to talk to somebody, that's how you're going to get there. Anyways, this is just some helpful information. We also have a hot tip index, which is great. You can search by dental, and there'll be all the hot tips back to 2005 for dental, which I think is awesome. All right, so I'm going to go back to the provider page, and I'm going to go into my most favorite thing, the provider manuals. Now, for people that are thinking about enrolling in MoHealthNet, all these things are available to you. And I'm available to you to provide training. This training is just really going to be big picture overall. Let's talk about MoHealthNet. Let's talk about dental. But I offer 2-hour webinars all the time on the dental program, which means I'll cover like all this stuff, the resources. I'll cover policy. We'll really dive into that, and I'll answer questions. It's interactive. And then I will cover the EmoMed billing portal, which even if you are only taking managed care, you still need to have, access to that to look at eligibility, which is really important. Okay, I'm going to click on provider manuals. Now we're going to click on dental. Something I like to bring to my provider's attention is this provider manual is 309 pages. Okay, that seems intimidating. You scroll down, you'll look at this table of contents, it's super drilled down, right? So how am I going to find anything in this manual? So we have made a cool resource, a really helpful resource for you guys. And I'm going to show that to you real quick. So it's over here under provider manual by section. And what this is it takes a step back from the provider manual. And let me make this smaller so you can see it. So you can see all the different sections and what's in every section. Now, the provider manual as a whole is really important. So I'm not going to say don't look at every section, but I'm going to tell you where the things are that you really want to know. Where's the meat and potatoes of your program? So you see these general sections. These are written to apply to all MoHealthNet programs. So there's going to be information in here that's not going to be necessarily drilled down to dental, but it will be important. But the ones that say program specific sections, these are all about dental. This is where you're going to find out if something's covered, what ME codes are not ME codes, but what services are under the limited adult dental benefit. All your CDT codes are listed in the manual, anything that's covered. So that's all going to be in there at your fingertips. I always tell providers, section 13, 14, 13, 14, and 19 are really going to be the places you find all your answers. If you ever have to submit a paper claim to MoHealthNet for fee-for-service, section 15 tells you how to do that. Now, some of the general sections are kind of, are important, of course. There's one here on prior authorizations. The MoHealthNet fee-for-service program has its own prior authorization process, which if you accept fee-for-service, it'd be helpful. So section 8 tells you how to fill everything out on the PA form. But then section 14, if there's anything special around a prior authorization for the dental program, it's going to bring that out. Bring it to your attention in section 14. All right, so let's go back to the provider manual. Oh, there we are. Okay, so what I like to do is just search by the section. So I'll do Control F, section 13. And really, what is this? This is a ginormous PDF document, okay? So it's going to be, you're really just going to have to bounce around in there. I would like to tell you that we are actively working on changing the provider manual format to make it easier for you to find information, as well as we're rewriting a lot of it to make it easier to read. So that isn't something that we're actively working on right now, and hopefully we'll be rolling out a lot of those changes in the near future. All right, so what I've done is I'm going to go to section 13 and I'm going to hit benefits. Okay. Benefits and limitations. Now, section 13.1 addresses the limited adult dental benefit. So all the codes for participants that are over the age of 21 that are not blind, pregnant, or residing in a nursing home are listed right here. Okay. Yeah, and I want to tell you that they're not in code order. So like DO 150 is a covered service. And there's several others. So you'll have to just kind of go through this. I always tell my providers to search by the code. And then if you see it's in this chart, then you know it's covered for the limited adult dental benefit. So here are the codes, which is awesome considering in 2016, like prior to that, they didn't have anything. So I'm really happy that this happened. Now, I want to bring a couple things to your attention that a lot of providers don't know, but it's really helpful to know. So the limited oral evaluation, which is problem focused, over here in the requirements, it says none. Later down in the provider manual, further down, and I can show you that here shortly, it says limited, it says one time every 2 years for all MoHealthNet participants. So this code truly is only allowed one time every 2 years, okay? DO 120, which is your periodic oral evaluation, right? That pretty much a set standard benefit for all insurances, right? It is not covered for the limited adult dental benefit, okay? A lot of providers ask about that. We do have, I inform providers on how to do self-pay agreements. So in those situations, those individuals would have to, they'd be responsible for that exam. But we do offer a lot of other benefits. So I know that when they were considering this, they had to take a lot of that into consideration because, of course, we only had a limited amount of money. But I just wanted to let you know. So those individuals, they would have to pay out of pocket and do a self-pay agreement. Self-pay agreements really is on the day of service, you tell them this is not covered, and then they agree, prior to you rendering services that they are, they're responsible for it. It's signed by the participant and signed by, could be someone in your office. But basically it's to protect you and the participant, and that you've told them that something's not covered and that they are responsible for that bill. When we go to a doctor's office, normally you sign paperwork. Okay, yeah, I'm going to sign this, basically saying I'm responsible for whatever my insurance doesn't cover. With Medicaid patients, it's different. It's program specific, or it's code specific, like what service you're providing, the date of service, like they have to do with the day that they're going to have the service, the procedure. But I just wanted to let you guys know that that's just something, there's not a form for it. So it could be just something that you guys put together, but it's important that you do that. All right. So like I said, these are the benefits for the limited adult dental benefit. Now down here, there's some more information. So there are additional, a patient could qualify for more benefits based on trauma or underlying medical condition that their physician says that they need, and so that it doesn't get worse, right? Now, prior to 2016, this was more applicable. Now, I mean, it's still important, but a lot of the benefits that they would need would be covered in the limited adult dental benefit. I want to go ahead and mention that dentures are excluded. Dentures are not covered for the limited dental benefit, so they're not covered, okay? And they can't ask for it through the medical necessity piece. I'll scroll down and kind of show you a little bit about that. This is not a MoHealthNet form, but this is really kind of what we're looking for if you're going to do this. Now, I think the managed care plans do something similar to this. But like I said, it's not a form. It's something that you guys would put together yourselves, but it's information that we would want. Okay, so this right here, I'm just moving on down through the section and just hitting some high level things. Diagnostic exams, DO 150, that's a code that a lot of providers ask about. That's like one time, like a new patient exam. And that would be one time every 3 years. So like say if you saw this person today and then you don't see him again and it's past like a 3-year period, then you can go ahead and provide this code again. You can bill this code again. And this is like one time per provider per participant, and a provider is the doctor's office, not every single person, every dentist in the office. It's one time per organization, right? Anyways, I just want to bring that to your attention. Participants eligible. Look here. So periodic oral evaluations may be reimbursed 2 times per calendar year. So most of these participants will be in a managed care plan, but if for whatever reason they're in fee for service, this is kind of how we break it down, how it's covered. It's every within a 6 month, twice a year. So it's not exactly 6 months to the day. So the managed care plans most likely are doing the same thing that we say here in our policy manual. What am I doing? Here we go. That's not what I want. Like I said, there we go. Custom made items. This is something I like to bring to providers' attention. So say you're doing dentures, okay, you're making dentures, and this participant came in and they were eligible for dentures because they were pregnant, right? They had some complications, and then they lost their Medicaid benefit, okay, because they came back after they've had the baby, and let's just say they lost their eligibility or their eligibility changed so that they would not qualify for dentures. If you started that process when they were eligible for dentures, MoHealthNet's going to honor that, which means you can go ahead and provide the dentures to the participant because it's a custom made item. Okay, as long as you started prior to them losing eligibility. The same thing is if they pass away. So providers that are dealing with, nursing home participants, that type of thing. Sometimes people pass away. And so that isn't a loss to your practice. So this section of the manual just tells you how you would bill for that. The same, oh, well, yeah, that's it on that. All right, so I'm going to move to another section of the manual. This is where all the benefits and limitations are. If you have questions about anything specific, you can ask, as well as we can set up, we can have a conversation via email. Jesse can provide my email address. All right, so I'm going to go to section 14. And I'd encourage you guys, if you're going to accept MoHealthNet, which I hope you are, to go to section 13 of the manual and just skim it, because a lot of that information is just going to jump off the page, right? These are things that really matter. So hopefully you'll see things that are important. All right, so section 14 of the manual discusses special documentation requirements. So an operative report, prior authorization. And I had mentioned earlier, section 8 of the manual discusses provider or prior authorizations. It tells you how to fill it out line by line. But this right here tells you some specific things just around the dental program. All right, I'm gonna look at section 15 real quick. Whoops. This right here just tells you how to fill out the claim form. Now, this is specific to fee for service if you have to mail it in. There are situations where you do, if like there's an x-ray required or something, you would have to mail it in and complete the claim form. We do use the 2019 ADA dental claim form now. And we're going to go to section 19, which is one of my favorites. Go to section. All right, so section 19 lists all of the dental codes that are covered for children, pregnant, blind, and people residing in a nursing home. I want to bring this to your attention. You see these little asterisks and little symbols. Like this one means only covered for trauma or underlying medical condition. This chart was in here prior to 2016, and this would be how an adult that was not within, children, pregnant, blind, or people in nursing homes would access this benefit. So if it's on here, then the people in this, which would be children, pregnant, blind, and people in nursing homes, would actually qualify for this. Now, there's limitations over here, like there's no age limitation for this code, DO120. There's an age limitation for DO145, 0 to 2. It'll list the rates over here. Now, the rates sometimes change, like sometimes we'll do like a 1% increase or 2%. So we do have a fee schedule that's on the website that talks about that. But you can just scroll down through here and see some of the things that are covered, and the ones that have age limitations, like this one, DO340, is only covered for 0 to 20, and it gives you a rate. Now, if a prior authorization is required, it'll say PA, like this one. It's a prior authorization. Now, the managed care companies have prior authorizations as well, but they have different processes. Like you'll send it in through their portal or what have you. MoHealthNet's prior authorization process is still paper and things being mailed, because we don't have a way to accept it electronically. But like I said, those are things I can explain to you. If you come to just a regular webinar, we can walk through some of that stuff. There was an MP on one of these that I kind of skipped over. MP means manually priced, right here, MP and then PA. So this code, which looks like kind of a dump code where you could put things that don't have procedure codes. It says MP, which is manually priced, and then the PA. So you'd provide documentation. Does anybody have any questions right now? There's a ton of benefits listed in section 19. All right, I just wanted to give you guys a general overview of the provider manual. Now I'll go ahead and go back to the fee-for-service provider page. And I like to just hit on some things that are kind of important to you guys, things that a dental provider would want to know. It looks like I have one question in the chat. I'm going to go ahead and try to answer this. The periodic is covered for limited Medicaid recipients. So Alicia is asking if a periodic exam is covered for limited Medicaid recipients. So if a person is in the limited adult dental benefit, the DO120, the periodic exam is not covered. It is covered for children, pregnant, blind, and people residing in a nursing home. So it's not covered in the limited program. But DO140 is. So that's helpful. All righty. Okay, so looks like we got a couple more. Let's see. Linda is asking, can a dental or dental hygiene school be a MoHealthNet provider? Yeah. Actually, I went and spoke at the KCU in Joplin. They're opening a new dental school, and that's exactly what we talked about. Yeah, that can happen. So if you need more information on that, you can reach out to me directly, and then we can talk about that and how you guys would go about doing that. Okay, so we're back on the provider page. I'm going to just hit on some things that are kind of important. Billing. If you need to access EmoMed, there's some quick links here to sign up for it. Claims processing and payment schedule. This is important to providers. When will you be paid? Now, this is MoHealthNet's fee schedule, or not fee schedule, when we pay things. So this last column will be when you have to enter your claim by 5 o'clock. And this second column is a corresponding direct deposit date. So that's kind of how that works. Remittance advice, remark codes, and claim adjustment reason codes. I want to just bring it to your attention that we have like lots of resources out here on our page. And a biller, and a lot of you may not be billers, but a biller needs, like if there's a private insurance that they had to bill, right, and they'll give them a remittance advice or an EOB, and that information has to be provided to MoHealthNet on the claim. And if it's fee for service, I can walk you through how to do that on a separate webinar. But this is where all those codes are and what they mean. So you may see like a PR1 or PR2, which would be patient responsibility 1, which is deductible. There's co-insurance, there's contractual obligation. Sometimes you'll see non-covered, so it'd be like PR96. So this is just a quick link to help you. If you're a biller already, you may know about that, but we like to provide resources on our page so that it's kind of a one-stop shop, right? So you guys can go out here and find things that are helpful. All right, so I just want to answer this one question real quick. So for special needs children requiring care under sedation, sometimes treatment is determined to be needed after the patient is sedated. If that treatment typically requires a pre-op, what is the process to provide care and be compensated for that? So if it depends on if you're going to be providing it in an ambulatory surgical center, or like in the hospital, the operating room there, sometimes a lot of providers would do that. Depending on if they are fee for service, if they're managed care, there's different processes, but that is covered benefit. You know, for children, special needs, adults. So the managed care plan is going to have their own process, which I can't tell you what the process is, but you would reach out to them directly, but it is something that we cover. So what would happen if it was performed in, like, say, an ambulatory surgical center? The surgical center would bill us for time and space, basically, right? And using their supplies. And then the dentist would bill us on a professional, like for professional services on a dental claim. So it is something that people can access through Medicaid. All right. There was a follow-up question specifically for treatment that needs a pre-auth for like a root canal, if we can't get an x-ray in the office. It really depends on the, like, if they're through managed care or if they're fee for service. But if you're having a problem with this, you can reach out to me directly, and then we can discuss it and see if we can figure out a way around that process. Normally it's not a prior authorization with fee for service. The actual like procedure could be, require a prior authorization. But there's a difference between fee for service and managed care. I think managed care has like a point sheet or something that you have to, justify why this service needs to be provided in that setting. So there's a lot of different things that go into that, but we can always have a side conversation about it if, and Jesse's going to provide my direct email. That way you can just reach out to me and we can talk about it. Awesome. Thank you. All right. So I wanted to go down to provider forms. Provider forms, we have several forms out here that are helpful. The prior authorization forms out here, but there's two that I like to bring to your attention. And this would be for providers that are offering, providing services to participants in managed care. This is still applicable to them, okay? So the insurance resource report form. Providers are required to check eligibility for all MoHealthNet participants. You'll go into EmoMed. You also can access it through the managed care plans, but EmoMed is it's like the hub, right? This is where we provide the information to the managed care plan. So this is like the gospel. You go to EmoMed and that's true eligibility. Okay. So it's really important to go there and look at it. So say a participant has an other payer, like say mom has UMR insurance and they have Delta Dental underneath that benefit. You would bill them first and then you'd report that to MoHealthNet. So the purpose of this form is, say you bill them and they say, oh, they don't have this policy, then they no longer have that coverage, right? So this form, you could just report that and email it into our TPL database unit. And then they will investigate it and say, okay, do they have that insurance? If they don't, they'll just remove it from the participant's file. Because a lot of times you're going to be seeing the same patient over and over, right? And there's no reason to waste your time to bill that primary if they don't have that coverage. But as long as it shows up on there, our system's going to deny your claim if you didn't do it, right? Sometimes you guys are made aware of insurances that we don't know about, right? And this form is also used for that, to report insurance that Medicaid doesn't know about. I always tell my providers, make sure you bill that other payer, even if we don't know about them, because what's going to happen? We're going to eventually know about it. And then we're going to have you bill them and then report it on the claim, you know, and it causes issues. So we want to make sure to bill them if we know that they have that payer. So that's an important form that I like to show you guys. Another one that I'll briefly talk about, because it doesn't impact everybody, especially if they're in managed care. But some of you, if you're going to take fee-for-service participants, this is important. So there's something called a spin down, and a spin down is the difference between somebody qualifying for MoHealthNet and not. So say this is going to be real simplified, okay? So if somebody's over income by like $100 to qualify for Medicaid, then their spin down could be $100. And a spin down's like a deductible kind of, so they'd have to meet that spin down every single month that they want to use their Medicaid. Now it's a little different from like you or I, we pay a premium every, you know, out of our paychecks, every paycheck or once a month or what have you, right? Individuals that have spin down only have to meet their spin down if they are actually going to use their MoHealthNet benefit. So say they have a big spend down, like well, let's just say $300. They're not going to want to pay that every single month. But if they're going to go to get glasses and go to the dentist and have several doctor's appointments, they're going to want to use, you know, pay their spend down. So there's different ways they would do that. They could have it auto drafted. They can send in a check, or they can submit incurred medical bills. All right. Now, why am I going to talk about this provider spend down form? If a provider sees that a patient has spin down, which will be on the eligibility screen, it'll say why, and then it says spin down. If they see that and it says inactive and there's no ME code, which I have a PowerPoint that goes over this, okay, it tells you how to look at it, but let's just talk about it big picture. They can go ahead and provide service. Say their spin down's $100. You're going to provide $400 worth of services on the 3rd of the month. Okay. You're going to say, hey, you're responsible for this $100, but I'll go ahead and perform services. Right. And then I would send this form in, you'll email it in, super easy. And then the spin down unit's going to see that, and they're going to update it and turn their coverage on, which then when you submit your claim, is going to pay up to the allowable on the code, less that spin down. So that participant is still responsible for that $100, but MoHealthNet's going to pay the rest, right? So that's why this form is important, so that you're not telling people, I'm sorry, you haven't met your spin down, I can't see you. This basically will help you with that. Now, they spin down has to be met every month, right? They could be met based on a service like this. I said they did it on the 3rd of the month, right? And so they wouldn't be eligible for MoHealthNet the 1st and the 2nd, but the 3rd, once they've met their spin down, they'll be eligible to the end of the month. And then it starts over every single month. So that's kind of, you know, big picture what spin down is and the purpose of this form. The process, I'll tell you right now, is 2 to 3 days. So it's awesome. It's really quick. There's I have some resource information and who to contact about spin down on our resource guide. So that's a form that I always think that we need to look at. Now, the prior authorization forms out here and several other things, but we can always get into that another time. All right, so let's go back to the provider page. There's another form down here, provider update request. Missouri Medicaid Audit and Compliance is your enrolling and auditing body, right? So if there's something that's changed, like say you have a contact set up for your office and that person left, and then there's a new person, right? And they probably have a different email address. If you want to update the email address, you want to update the phone number, any of that stuff, you can submit a provider update request. And this is important because if I'm trying to get a hold of you, I'm going to go to the provider file and I'm going to look, and that's the information that's there. And if you haven't updated it in 5 years and you went through 10 individuals that were set up as the contact, then we don't have a way to get a hold of you, right? So a lot of times we'll pull those email addresses and email you guys a mass email, and I get a lot of them back. So I always tell people, please try to keep your information updated. And this is a way to do that. Okay, general information. There's not really anything there I want to talk about. Fee schedule. All of our fees are out here. I'm going to hit accept. I'm going to show you how to use this. So we've got two options. We got the download and the full search. I do not recommend using the download. This is more for like a clearinghouse or something. It's just got big Excel spreadsheet. So I just prefer not to use that. The full search, you can go in and search by code. So over here on the left-hand side, it says dental services. And this is going to bring up all the dental services that are covered. So D0120. Let's talk about that code. It's super easy to talk about. All right, so I put the procedure code in, click procedure and go. So it brings up the rate for this particular code, tells you when we changed the rates last, and then it tells you if it's a payable code. So if you hover over this 3, it tells you it's payable. All right, there's different things that could be here. It could be like a 6. A 6 means, and like I said, you can hover over it and tells you. 6 means manually priced. A 9 means do not pay. Like it's just a not covered, it's non-covered. Okay, that's what it means. Now, why do you want to go look at section 19 and 13 of the provider manual where it talks about this code? Do you see any age limitations here? Do you see any extra information? All this is it's telling you this code is covered the last time we changed the rate and what the rate is. Okay. So I always tell my providers, yes, this is helpful, but it's not all encompassing. It doesn't give you all the information you need. So that's one reason why I looked up this code, because we talked about this a lot already, right? So it's important to understand how to use these resources. It looks like I have one question. Let's look to see what that's about. All right, so Melissa says, when we have clients on PE, temporary Medicaid, they're on a fee and they're on fee for service. If they need care that will require a PA, can we move forward with it while they're on temp? Or do we need to wait until they get assigned to an MCO and do the PA through the MCO? I think temp Medicaid has some restrictions. I'd have to look at that specifically. And they don't normally stay on temp that long. So I'd have to look at what services they would get. So that'd be kind of a side email. Jesse, can you collect some of these questions and then email them to me? Then I can answer her. I have to really look at that one.
Yes, I'll do that.
All right, I appreciate it. Thank you. Melissa, I'll get back with you and we can talk about it. Okay, so I just wanted to kind of teach you about this resource. Let's go back to the provider page, which, like I said, is the hub for all the stuff you need. Let me scroll down, education and training. So this is all about us, right? Education and training. So I'm going to click on our training resources. We've changed this a lot. So we do schedule webinars quarterly. So there is a quarterly list of webinars as well as a Google Calendar. So if you guys want to go out there and see when we have trainings available. Trainings, like say you need a training, but you can't go on the date that it's set. Okay, well, that's fine. You just contact me and I'll set up a training for your office. Not a big deal. We can set up trainings, like say you're having all kinds of claim denials and you're like, Amanda, I just don't understand. Okay, we can set up an hour and just go through your stuff and talk about it. So that is, what the education unit does. Now, like, we do have provider communications, but if it's really about training or lots of issues that you really need to break down, that's when you would just reach out to me. And so we can make it all about you, or you can have someone attend just a general webinar that we just, talk about everything. All right, so we do have some new changes to our website. I have dental resources. So I have a PowerPoint that gets more in depth on all the policy stuff. And it also shows you how to enter claims on EmoMed. So a lot of things I talked about, but it gets into like every section of the manual, talks about prior authorizations. It's more detailed. So it just brings up things that you need to know. Now here, I give you claim samples and I show you how to file other payer, which is important. Talk about Medicare. A lot of providers, they don't think about Medicare when it comes to dental. Medicare Part B does not cover dental, right? So we wouldn't require you to bill it. But you see on TV all the commercials for like a replacement plan like Humana, different Medicare Part C plans. That's what we call them, Part C. Those plans could potentially offer a dental benefit. So we have our providers bill them. And then if they don't, you'll get like a non-covered PR 96 code, and then you just put it on the claim form, which is through our portal. And this PowerPoint that I brought up, it shows you exactly field by field what you're supposed to do. But Part C, you do have to bill them. You do not have to bill Part B. There's other resources out here. So the dental resources is that PowerPoint. There's also something that we wrote for the MDA. There's articles out here talking about the rate increase. And now what's the next steps? There's a lot of really good information out here, kind of like FAQs, things that providers ask. So that's something that was published. And there's 2 of them out here. There's another one is general PowerPoints. There's one that's like overview of everything, which would be like the website, showing you how to use the provider manual, kind of giving you some high level on EmoMed. And we have it broke out too. So provider resources, eligibility, and spin down. So I really drilled down into spin down on that PowerPoint, and kind of how do you know if they've met their spin down and not? So that tells you about that. EmoMed overview. There's also the provider manual by section, which I brought up earlier, that tells you what sections you really want to concentrate on. And then there's claim filing. This really isn't for you guys. Okay. Third-party liability. This is really cool. This tells you what third-party liability is, which is what other payers. So like they had Humana or they have Delta Dental. This tells you kind of about that. And there's a training here through a new software that we have, that you can go in and do a training course just talking about TPL and how do you know if they have TPL. So it'll show you the EmoMed screens, which even if you're just taking managed care, right, participants, you can go out there and see it. It's really easy to see. And this right here tells you how to do that. All right, so those are the things I think pertain to you guys. Okay, so that's under education and training. Contact constituent, we're not constituent, contact education and training. So you can click on that. This breaks down, there's 4 education reps, okay? So each one of us has different programs. I am over the dental program, but I don't teach any other ones anymore. These used to be my programs. We have a new person, Lee Gerloff, and she is taking those on. I'm only keeping dental, and then I'm overseeing several, like all the resource and that type of thing, special projects. But you guys can contact me because I am your dental person. All right, so provider resource guide. This is really important. This is where you can get information is all in one spot so that you're not having to look everywhere. So this just tells you about the program, MoHealthNet fee for service, managed care. It gives you lots of different resources. So TPL, we talked about that a little bit. And then it gives you the training course, education and training, which is me for you guys, the spin down unit. I mentioned that. Here's where their contact information is. They're great to deal with. You call them, they answer the phone. They're awesome. So if you ever have any issues with spin down, you can call them. This gives you general information on the health plans. Now, this is something that's really important that I want to bring to your attention. Okay, those that are going to work with the managed care plans. You're going to build a managed care plan and you're going to go through all their processes. Okay. If for some reason there's something that you cannot get resolved with the managed care plan, we have a managed care liaison. So within our unit, in my unit, there's 2 ladies that handle this. So you guys would submit something and say, hey, I can't get this claim paid. I can't find somebody to help me, or I'm having an enrollment problem. I can't get a hold of somebody to get my enrollment to go through. Any number of things, but we ask that you try to work it out with the plan first and then contact us. And so what'll happen is you'll let us know there's a problem. We'll reach out to the plan and say, hey, this provider has an issue. We need you to contact them. We give them a time frame. We say, reach out to the provider, resolve the issue, and then we ask them to respond and letting us know what the resolution was. Now, does that mean that everything's going to be the way you guys want it or the provider wants it? No, but there's some accountability there, right? So that you can get that question answered, which is really helpful. And the plans, they try really hard to make sure that they help you through all those processes, but that is the next step. Participant services, say somebody has a question, participant does, this is their information. Oh, provider communication, super, super important. Okay. So provider communications is your first line of contact. So like if you have a question about eligibility, if you got a question about a claim denying, those types of things, you would reach out to provider communications. There's two different ways to reach them. There's phone number, and there is an option to send a direct message to them through EmoMed. It's called Provider Communications Management. If you go into EmoMed, you can click on it and then, write kind of like an email, just send them, hey, this is the issue, and they'll respond to you. I always think they respond within 24 to 48 hours, but they do have 72 hours to respond. This is great. The portal option is great. Provider enrollment. This is MAC's information, Missouri Medicaid Audit and Compliance. They handle the enrolling as well as auditing. So if you are wanting to enroll with MoHealthNet, you would enroll with MoHealthNet first. And then if you want to take people with managed care, then you would enroll with the managed care plans. Now, we are kind of helping our providers through that process. And that's where Jessie Emmerich, she's going to be helping you guys with that. So you can reach out to her and she can help you navigate that process. Technical help desk, say you don't know how to access EmoMed and you want to sign up for it, they'll help you. And then, like I showed you before, here's all those ME codes. So they're all listed on this resource guide. Provider manual by section, we already talked about that. Benefit tables, this is really good for intake, like say somebody making the appointments. You click on dental and you can see who is eligible by ME code for dental, okay? And then some are marked limited and some say no, like this one, 8089 for family planning, that is no. But most of the rest of them are covered. Limited, if you look down here, there's just some additional notes and quick links to things. All right, this is the information for Missouri Medicaid Audit and Compliance. There's an application. You can go there and do all the enrolling. All right, so let's look at some of the questions you guys have, and then I can go through EmoMed, just like a big overview and show you what that looks like. All right, so Alicia is asking, just to clarify, if the code isn't listed for the program, example, a 14-year-old in foster care program, then it is not covered, a non-covered service. So a sealant repair is an example. So it would have to be listed in section 19 for a kid. So the child would receive the comprehensive dental benefit, but if you don't find that code on there, then it's not covered. Now, if I recall, like sealant repairs, like I think that there's like a certain time frame, right, with the sealant that you guys have to cover it if there's an issue. I'm pretty sure that's a thing. But I mean, I think we can get into it in more detail. Okay, so and Alicia, you can send me stuff directly, things that you're having issues with, and we can like really talk about it. Karen Dent, let's see what she says. This information is amazing. Oh, she's telling you about me. So I've known Amanda for a few years. Oh, I'm not going to read all that, Karen. Somebody else can read it. So, yes, I've provided education for a long time for the dental program. So I have a lot of information. If you guys ever want training, please feel free to reach out to me and I'll set something up for you guys. So thank you, Karen. I appreciate that. All righty. So let's look at some EmoMed. EmoMed. I love EmoMed. I think it's great, but I don't bill other insurances, so I don't know what other people's portals look like, but I love ours. So I'm going to go in here and bring it up so that you guys can see what it looks like. So when you sign into EmoMed, this is what it looks like. So before I signed in, actually, I'll go back out there real quick. Right here, you can register now. So if you don't have access to it, you'll register. It'll send an email or notification to the person that's set up as the administrator for your account with EmoMed. If you don't know who the administrator is, you can call the help desk, and that number was on that resource guide, and they'll tell you who the administrator is. And we know there's a lot of turnover, right? So they can get you all set up. But if the administrator's set up and everything's working perfectly, they can give you access to that MPI so you can get into the portal. All right, so here's some helpful information. If you have to go through provider revalidation, you can click on this. There's a YouTube video to help you through that, which could be handled through the portal. It'll send a message and say, it's time for you to revalidate. All right, so I'm going to kind of hit high level on these things real quick. Attachment management is not pertinent to dental providers. So through fee-for-service Medicaid, you cannot just attach a prior authorization or x-rays. Participant eligibility, this would be for everyone, even if they take just managed care. You can go out here by the date of service and DCN. You don't need to do all this extra. So it's like the day they're coming in. Actually, it'd be the current date or a past date. So whenever somebody contacts you to get an appointment, look their eligibility up, and then look their eligibility up right before they come in, because eligibility can change. They can go to a different plan. All kinds of different things can happen. So I don't recommend that you span your dates, because like say somebody's like, okay, they called in today, but they're going to come in on, what's today? Say they're going to come in February 3rd. All right, you don't want to span today to February 3rd, because you could get projected eligibility, which is not true eligibility. Okay, don't do that. Now, there are reasons you would span dates, like say you want to know when they met their spin down. I mean, that's really the only reason I would suggest spanning. The rest of it is data service specific and DCN. That's it. Hit search. Whoopsie, I hit search. You hit search to bring up the participants' eligibility information. And I have a PowerPoint out there that shows you how to look at it, tells you what it's going to look like. You guys can go out there and look at it. But that'll help you through that. Prior authorization status. If you're submitting PAs to fee-for-service Mental Health Net, unfortunately, they have to be mailed still. They still have to be sent in the mail. But this is where you can see, okay, did we receive it? Is it in pending status? It'll bring it up right here. So you'd search by DCN. I don't recommend you drill down here, but search by DCN, and it'll bring out all your PAs for that particular participant. It'll tell you if it's approved. Is it marked incomplete? Is it denied? It'll break it down by line. So say one is marked incomplete. That means the information you provided wasn't enough to justify an approval, right? So sometimes it's like an office note wasn't submitted correctly, or the x-ray wasn't clear enough. So you would have to send another PA in for that. Just make sure that you don't submit a PA for something that's already been approved, because it can kind of slow down that whole process. So I always tell my providers, send the same PA form in with all the stuff and just like whatever extra information, and then mark through the lines of the things that were approved. But anyway, that's just some helpful information on that PowerPoint that I have for you guys. That I showed you, it's going to get into some real detail on, helpful hints when it comes to the prior authorization process. One of my favorite things, provider communications management. This is where you can send a message directly to provider communications and they will help you. Okay, so I have a question, why this claim deny? Why did it deny? Well, this is how you could send them a message and they'll respond to you and tell you, oh, that's the wrong code, or the patient's DCN was wrong, any number of things they can tell you. Okay. Now, personally, I like things in writing, right? So you can send it to them and then the answer will be here to that question. Participant annual review. Now, this is going to become way more important now, because people are going to have to start checking, people are going to have to start submitting their financial information, making sure they still qualify for Medicaid, and all this stuff. You're going to start noticing things change. Okay. This is something that's helpful, especially for some of those organizations that are all encompassing, like an FQHC, Federally Qualified Health Center. You guys have your hands in all kinds of things with a participant, and it's important to be able to see this information. So if you want to look at it, it's there. I mean, you don't have to, but it's out there for you. Nursing home, this isn't pertinent. File management, this is where your remittance advices and your claim confirmations are going to be. Now this is like the testing environment, so you won't see all the things you would normally see. So there's no remittance advices on mine, but we have those 2 cycle dates in a month. I had told you about the cycle dates when you have your claim in and when it'll pay. So the remittance advices, there'll be 2 months of information out there. So they'll be listed here. And then a claim confirmation, that is, say you submitted like a whole bunch of claims yesterday. So a claim confirmation is going to be generated overnight and it's going to show you what you did. So like on this day, I entered 3 claims. Okay. And it just tells you, is it in a denied status? Or is it in a paid status? That type of thing. Whoops, I hope I didn't close email mag completely. Probably did. Hold on just a second. Oh, there we go. All right. So another thing under file management, I said remittance advices are out here. So if you see request aged RA, you can actually request an old one. So like I told you, it was, there's 2 months of information. You request an old one from using a cycle date. And I think it only goes back a year, but still, especially if you're new to the practice and you're trying to figure out what happened in the past, you can go out there and look at that stuff. And then the last 2 direct deposits. And another thing that's really important is provider enrollment status. So this is where you can go out and see if, say, there was a provider in your practice that had to go through the revalidation process. You can go out here and look to see if they're active. Say you have a new provider coming on board and you've already sent your enrollment applications in and done all that, right? You can just go out here and see if their enrollment is done. Okay. I mean, it's just an easy place to check. All right. Now I can go into claims right now, and just kind of give you an idea. I mean, just a big picture of some of this. But we won't get into it too much because we don't have much time left. Over here, there is search options. You can search by DCN and data service to find a claim that you submitted. I'll just show you real quick. We're in 2023 right now. All right, so let's see. All right, so like this is all the testing environment, so they'll have a bunch of different claims out here. So this will bring up all the claims that you submitted. The first claim that you submitted is on the bottom, the newest claim is on the top. This is important. Every claim has a different number, which is an ICN number, which is the claim number. You guys would always submit a claim on a dental, like a dental claim. You always will do that. Now I can run through how to submit a claim on here, or I can answer questions. Do you guys want to open it up for questions for the next 10 minutes, or do you want me to go ahead and go through claim samples?
I think that's a good idea. Let's see if there's any questions from our attendees. It's been a lot of good information. If you have any questions, just go ahead and put them either in the chat or in the Q&A, and we'll have Amanda answer those.
Now, oh, sorry.
Oh, go ahead. I was going to say, we may even let you talk if you would rather do it that way.
Oh yeah, that's awesome. I like to hear people ask the questions. So yeah, if you guys have any questions or any feedback for me, I'll be glad to answer those.
I'll just note this was designed to be kind of a high level overview for, a relatively short period of time. Obviously, there is a lot more detail to cover in all of these areas. And one reason we wanted to do this, though, is we have a very good panel on Medicaid dental at the conference, and we wanted to make sure people had at least the basic information about Medicaid and how it works available to them ahead of time.
Yes, and I'm going to put the link for the conference in the chat box. So you guys can go out there and look and see what we have going on. The panel is going to be really great. It's going to have Amanda again speaking about MoHealthNet. It's also going to have Dale Carr with MMAC, just to kind of give you an overview of what they do, and also the MDA and how we're all working together and how we can assist you as providers.
Now, if nobody has any questions, I can always go ahead and go through a claim for them, since we have a few minutes left. All right, so I'm gonna and interrupt me if you have a question. Like, really, I will answer it. Okay, so I'm going to show you how to enter a claim on our portal. Now I'm going to put I'm going to enter all the required fields so you kind of know. Oopsie. All right, so we got our DCN, patient's name, first name, last name. The name, like if their name is Robert, don't put Bob in here. It'll be whatever their name is with MoHealthNet. Patient account number, if you have an account number that's specific to your your practice, like say somebody has, you assign numbers in your database to somebody, you can put that there. It's not a required field. All right, your performing provider. I'm not going to get so detailed in some of this stuff. It's just general. Now there is a new field here. Place of service is required now. And you don't have to put diagnosis. It is an option. You don't have to do it. So that's, whoops. I wonder what happened there. I'm clicked on the wrong thing. I'm sorry. All right, so that is my claim header. Then I have my detail line. My performing provider. And then I'm just going to put something really general in here. DO120, which is my go-to. You're billing $100. So here's my bill charges, which is my normal customary rate. Do not just put what the fee schedule says, okay? Because we'll pay you less. You know, say like this giant increase that we had, if you would have put $24 in there and we reprocessed all those claims, you're just going to get paid $24. So you have to bill us your rate. There's 1 unit, and then I'm gonna hit save. So this is my detail line, and I'll enter another one just so that we, whoopsie, it was on the first, wasn't it? And this is just to show you how this works. So that might not make sense. All right, so there's my 2 line items, okay? That's it. I'm done. If this person doesn't have an other payer, then that's all you have to enter and then hit submit. Now the other payer information can be submitted here. So I'm gonna hit submit. And I'm going to give you just some like general information about this. So you can see a claim status here, a status, a category code, and a category code. If you go to the Washington Publishing Company, that could give you information on how that claim paid, why it denied, whatever, right? Now the information on your remittance device is much better. And if you can't figure it out, you want to contact provider communications. Now across the top, I just want to mention a couple of things. You can void or replace a paid claim. Voiding a claim, we don't recommend it. Only do that if we tell you to, or you never intended to bill it. Replacing it, if part of the claim paid and part of it denied, you can click replacement, go in and fix that line. Okay, I want to just mention timely filing. And I know that we're running out of time. I just wanted to hit a couple of things. MoHealthNet's timely filing is 12 months from the date of service. You can file your initial claim. If you file your claim within 12 months and you need to go in and fix it, and it's 16 months, you click on this timely filing button and we'll allow you to adjust that claim up to 24 months. Okay. But the catch is you have to submit the original claim before, like within that 12 months of the date of service. So you would submit this and then we'd be able to let you correct the claim. This right here is what most people use. If a claim denies, copy claim original, that's exactly what it's doing. It's copying the original claim. Then you just go in and modify it. You can modify everything except for the claim form, which doesn't matter because you're never going to go on any other claim form, or the billing MPI, which is what this advanced functions for. And then you have a printer friendly option, which tells you everything that you entered. Here it is. So it just, that way you can print it out if you want to, or look at it. It's really helpful when there's another payer involved. I'll just show you how you can modify this claim real quick. If you click copy claim original, you can go in here, you see this little edit function. You can change like anything. You can change their name here. I want to change it, save it. I want to change this to this. Save it. You're done. Hit submit. You have a whole new claim. It's that easy to use this portal. I won't get into the other payer portion because we've ran out of time, but if you guys have any questions, feel free to reach out to me. Jesse's going to provide my email address, and I'll be glad to assist you guys with any kind of training or questions you might have.
Yes, you should be receiving an email shortly that'll have your survey for your continuing education credit. That email also has Amanda's contact information and my contact information. If you have any questions, please let us know. Amanda has shared some wonderful information, a lot of really great resources for us to use. And we really appreciate you being here today, Amanda.
My pleasure. And like I said, just make sure you guys reach out to me if you need me. Thank you.
Thank you, Amanda and Jessica and everyone for being here. We hope you found this very informative. I certainly did. And Dr. Deaton is also thanking you in the Q&A section. Do not hesitate to reach out to us if we can be helpful in any way. And again, thank you for being here, and have a great rest of your Friday and a great weekend.
Thank you.